Hi, I'm Rena, Clinical Nurse Specialist.
Hi, I'm Chloe, Clinical Nurse Specialist. How you manage your recovery at home plays a big role in how well you heal. Whilst the Clinical Nurse Specialists are here to guide you, much of the progress you make will be in the steps that you take day to day. Recovery usually takes around 3 months, depending on the type of operation you've had. We have given you advice and information to help you take care of yourself during this time. The challenging part may be adjusting to the restrictions that we have set whilst trying to return to your normal routine.
As a part of our service, we will give you a call approximately 1 week after discharge. This is to assess your recovery progress by asking you set questions and giving you and your family support. Your cardiac surgery booklet is a great resource. Inside is details on week-by-week guide of what to expect, common side effects and expectations of activity levels.
Hello, my name is Gemma and I'm a wound care nurse. Most patients do not develop a wound infection. However, if you do develop a wound infection after surgery, it can impact your recovery and result in one or more of the following: additional antibiotic treatments, repeated wound care dressings. In some cases it may require further surgery and it could lead to a prolonged stay in hospital. Additionally, some wound infections can develop several weeks after being home. This may mean a readmission into hospital. Wound infections can vary in the location and severity. Signs to look out for are increasing pain, redness, fever, and any discharge coming from the wound site. For coronary artery bypass graft surgery, you can develop a wound infection in your chest wound or your leg wound where the vein has been harvested for bypass. In valve surgery, you can get a wound infection in your chest wound. If you do have any concerns about your wounds, please contact your GP surgery promptly and also inform our SSI surveillance team on 01223 638 033.
Hi, I'm Vicky from the Cardiac Rehabilitation team.
Hi, I'm Helen from the Cardiac Rehabilitation team. After cardiac surgery, you will have a wound down the centre of your chest over your breastbone. It's really important that you limit the activities you do with your arms and your chest muscles so it allows time for it to heal properly. Ladies, you will also need the additional support of wearing your bra at all times for a minimum of 12 weeks, even at night time. Please ensure that you follow all the advice and guidance given to you by the physiotherapists and nurses on the ward on discharge. You will then be referred to your local cardiac rehabilitation team. The aim of this is to give you all the information and support you need to make the most out of your recovery and also to reduce your risk of further heart problems. Cardiac rehab normally consists of exercise sessions and health promotion. Your local cardiac rehab team will normally contact you around 6 weeks after your discharge from hospital. This allows you time to heal and recover at home. Remember, we strongly recommend that you attend the cardiac rehabilitation programme as it is an important part of your treatment.
Whilst waiting for your cardiac rehabilitation appointment, it's important to stay active and mobile. Try taking a walk every day. Something as short as 2 to 5 minutes would be great, and aim to build up to about 20 minutes by the time you're ready for your cardiac rehabilitation appointment. Continue the light arm and upper body exercises that were given by the physiotherapists on discharge, but avoid any heavy lifting, pushing or pulling. When you are moving, imagine that your body is in a tube and you're moving within that tube so that your arms stay close to your body, avoiding any pressure or stretching or strain across the chest. For most people, it takes between 6 and 12 weeks for the wound and the breastbone to heal and become stable. Within that time, it's important that there are certain activities that should be avoided. These include bowling, fishing, walking a dog on a lead, swimming, racket sports, golf with a full swing, and road cycling. Once you've started your cardiac rehabilitation programme, the team will guide you safely back to all of the activities that you enjoy.
If there is something you're concerned about and needing some extra guidance, the Clinical Nurse Specialist team have a non-urgent advice line. Our number is 01223 638 100, open 9 till 5, Monday to Friday.
You will then receive a letter 6 to 12 weeks after your operation regarding your follow-up appointment. You may see a clinical nurse specialist who will check your blood pressure, review your cardiac specific medications and discuss your progress.